In 2 years into this pandemic, it's hard to find anybody who hasn't gotten COVID-19, leading many to feel like it's inevitable. Some people even asking, do we need to still mask? What about vaccines? How is all that changing?
Right, Nick. So a new study is showing a reinfection could increase your risk of lasting health problems. Our Noelani Graf speaking with our health insider. And Nohe, this may have people thinking twice.
Well, because here's the thing, Allison and Nick, if you talk to anybody who has long haul COVID symptoms, they would gladly trade places with you. Then if you find somebody who has survived COVID once, they kind of have this feeling of invincibility. But a study like this hasn't been able to be done until now, as reinfections are becoming more common. So millions of patients were studied as part of this, their health records. And the important thing to know is that the risks were not lessened if you get reinfected despite being vaccinated.
As the potent Omicron BA.5 variant pushes through the community, even the vaccinated, people who got COVID early on are getting sick again, some for a third and even fourth time.
It's not something, to fool around with.
Doctors at Washington University in St. Louis looked at medical records of more than 5.6 million people treated in the VA health system. They found those with 2 or more infections had more than twice the risk of dying and 3 times the risk of being hospitalized within 6 months. They also had higher risks for lung and heart problems, fatigue, digestive and kidney disorders, diabetes, and neurologic problems.
Some serious severity issues. We already know that everyone is at risk for long COVID, even if you have a very mild course of COVID.
Researchers also found the risk gets higher with each new COVID reinfection. ABC 15 Health Insider Dr. Shadmar Vasti says that's a major shift in typical virus behavior, where we often build up in immunity each time we get sick.
Even if the case ends up being just mild, you could have risk factors down the line that you normally wouldn't have for something like the cold or flu.
The study notes older people or those with pre-existing health conditions remain the most likely to get reinfected.
Not big of an inconvenience, just to protect yourself and protect others.
So Dr. Shad says getting vaccinated and boosted is still your best bet to prevent getting COVID in the first place, and also that you should be masking up if you're going to be indoors and around other crowds. That is also your best bet to prevent that reinfection. So bottom line here, guys, it's that reinfection, getting it again, that you really want to avoid.
Yeah, and no shaming anybody who decides to mask up or get those other vaccines, because there are a lot of people who don't know what's going on in their own house, right? You see somebody, they could have someone who's vulnerable.
Absolutely, yeah, it's a good point. Noelani Graf live for us outside this morning.